Memedicine Cram Acyanotic Heart Disease, Flashcard Set 25, Atrial Septal Defect, Split S2. This deck of cards can be used for review for the National Council Licensure Examination. Before we get into the crux of this flashcard deck, acyanotic heart disease is a term for a group of heart conditions where there's some type of perforation either between the atria or the ventricle, along those septal walls, and that's going to cause a mixing of deoxygenated blood with oxygenated blood within the heart, okay? Specifically, an atrial septal defect, as I previously just insinuated, it's mostly a congenital heart defect in which blood flows between the atria or the upper chambers of the heart, as shown here. This is like a normal atria. It's probably really tiny to see, and these are atria with a hole or a septal defect. So you'll get oxygenated blood from the left side being shunted to the right side, okay? And we'll get into what a split S2 is in a little bit. All right. Okay, so when auscultating the heart of a patient with an atrial septal defect, an ASD, the healthcare provider hears a split S2. Okay, auscultation basically means listening to different organs in the body. It used to be with the stethoscope. I have so much issues with that word. It still is in most cases, but there's other methods of listening to sounds of organs, okay? And a split S2, well, let's just examine what that is. An S1 sound that you hear upon auscultation is actually a lub noise. It's the diastole phase of the heartbeat when the heart muscles are relaxing and allowing the chambers to fill with blood, whereas the systole, the dub sound, is a phase of the heartbeat when the muscles of the heart contract and blood is pumped from the chambers, specifically the ventricles, into the arteries. Okay? All right. So in a split S2, these two lines would be further apart. A split S2 finding upon auscultation of the heart sound is caused when the closure of the aortic valve So this enlargement right here would be the aortic valve, okay, leading to the aorta. And the closure of the pulmonary valve, this blow up right here, okay, are not synchronized normally. So instead of these being close together, they're going to be spread apart. So instead of hearing the dub, you would hear the dub, something like that, okay? All right. So let's continue with the question stem. What is the significance of this heart sound? Okay. Is it A, the split S2 is produced when the mitral valve opens with a snap? B, the S2 is normally split, so it is not a significant finding. C, when the ventricles fill rapidly, the split S2 is produced. Or D, because the closure of the pulmonary valve is delayed in ASD, a split S2 is produced. I'll give you a moment to select the correct significance, okay? All right. Okay, so a normal S2, as shown here, is produced by the closure of the pulmonic and aortic arteries, as I previously, not arteries, valves, at the beginning of diastole, the relaxation of the heart where, the chambers are filling up. It is the dub sound in the normal lub dub, okay? When the ventricles fill rapidly, so which answer choice was that? That was answer choice C, such as in cases when there is fluid overload, a third sound is heard. It's called an S3 rather than an S2, and the opening of the mitral valve, okay, is usually silent, so we don't really hear a noise. If a sound is produced when it opens, it's called an opening snap. So what I'm trying to tell you is that answer choice A and answer choice C are out. And the blood shunts, okay, from the left side of the heart, as I previously mentioned in the opening card, to the right side in an ASD, an atrial septal defect, increasing the volume on the right side, the deoxygenated side. And again, that's due to a perforation between the walls or the septum of the atria. When blood volume on the right side of the heart is increased, okay, the right ventricle is continually overloaded with blood, and this delays the closure of the pulmonary valve. Well, you can't really see it. It's like an enlargement of the underside, creating a split S2, okay, as the semilunar valves close at different times. So basically, answer choice D, because closure of the pulmonary valve is delayed in ASD, a split S2 is produced. If you want, put this on pause, take your time, dissect the anatomy of the heart in this depiction, and just go over it, okay? But don't spend too much time because I'm sure you have a ton of other questions to go over. All right.